Welcome to Beyond the Threshold, the podcast where we explore the evolving landscape of security across schools, sports, healthcare, cities, and beyond. Every episode, we dive into the challenges and innovations that shape how we protect our communities. Today's discussion is hosted by Evolve's co-founder, Anil Chitkara.
I'm here today with Jason Grellner. Jason is a longtime healthcare executive, particularly focused on safety and security in hospital environments. He's got a very interesting background. He's been with Evolve for 2 years and has had lots of conversations with hospitals across the U.S. And this includes hospitals, physicians, nurses, and all those people in that ecosystem around the healthcare industry. So, Jason, you've been in the healthcare industry for a long time. You've been with us for only a few years, but you've done a lot before that. Can you take us back far, far to your first role or your first job in healthcare?
Yeah, I'm going to take you back just a little bit further. As a 27-year veteran of law enforcement, I was in tune with violence. 22 of those 27 years were in narcotics. Some of that spent undercover, some of that spent overt. But very much in the thick of things when it came to crime and violence and inhumane practices that one human would do to another. After retirement, I was lucky enough to be able to move over into healthcare security, where I started out managing security for one hospital, very quickly moved to 5 hospitals, and then ultimately spent the most of my time as the executive director for Mercy Healthcare based out of St. Louis. Had 42 hospitals under my control, as well as 600 clinics, 76 retail pharmacies by the time I left, and just over 900 properties spread out across 7 states with 42,000 souls that we were trying to protect. And so I really got to see things pre-COVID, during COVID, and then post-COVID, and see the changes in attitude and ideology, which I think are really framing how violence is being perceived, seen, and dealt with in healthcare at the current time.
So, Jason, before we get into some of the trends in healthcare and more specifically in safety and security, can you give us a picture of what you were responsible for at Mercy?
Yeah, hospitals, when I was the executive director at Mercy, we had hospitals. Of the 42 hospitals we had hospitals ranging in size from small, what are commonly referred to as critical access hospitals, 24 beds or less, up to major level 1 trauma centers with 1,200 and 1,800 beds. Our first job, and actually the easiest of the 2 jobs, was to make the campus as safe as possible. We did that through our manpower, through our technology, through our policies, procedures, and programs. But the second job, the hardest job that we had, was to help people feel safe on our campuses. And that's a subjective issue. Depending on the person, their background, their life history, things that they've been through, things that they're going through, that's feeling of safety is so important in healthcare, because we want your healthcare professionals thinking about you, thinking about your health, trying to find ways to make your quality of life better. What we don't want them thinking about is, are they fearful of something at work? Are they afraid that the next person through the door is going to harm them? That was the part of the job that was the toughest, was helping people to feel safe, so that they could give you and the patients that they care for the best quality touches possible.
Jason, you had responsibility for safety and security before the pandemic, through the pandemic, and after the pandemic at the hospitals. I'm curious if you can talk a little bit about the nature of the safety and security issues, particularly before and after the pandemic. Did they change? How did they change? And what was the impact on the medical staff, the patients, the families that were in the hospitals visiting?
Pre-pandemic, hospitals were a place that you came for healing. When you arrived, you or a loved one might be in pain. You may be scared, afraid. When they're in an environment they're not normally in, they may lash out. And we saw that, right? We saw people who were in pain, who would not normally lash out, who may do things that they wouldn't normally do because they were using their reptilian brain and not their intellectual brain, right? We also had people who were in mental health distress. We had people who were in the throes of substance abuse disorder, who were now being brought to the hospital, who normally may have spent time in quote unquote a drunk tank or in the custody of law enforcement prior to the years just before the pandemic. When the pandemic happened, and the fear of the pandemic, the fear of coronavirus, the unknowns surrounding it, ideology became a large part of what we were dealing with. We were at the hospital level invoking rules that we may or may not even have agreed with, but that were being handed down by the federal government, state government, and in some cases, even county governments. Those included rules around visiting, especially a loved one who may be approaching end of life, around vaccinations, masking, the use of non-conventional medical devices and supplements. And suddenly, an industry that was implicitly trusted became a political hot potato. As people argued ideology, it's sometimes easier to be in an argument or to try to de-escalate someone using facts and figures. But when somebody's arguing ideology or a political ideology, it gets really, really tough. And so what we found were people arguing about ivermectin and whether masks worked or didn't work. Why should I get vaccinated? And all of this landed in the lap of healthcare. And a lot of times landed in the lap of the local hospital because, to tell you the truth, many clinics weren't even seeing patients. You had to be pre-screened over the phone or through the web before you could even arrive at a clinic at the time you were supposed to be there. Otherwise, they wanted you to report to the hospital with any illness. And so during the pandemic, you have heightened fear, heightened anxiety, political ideology, and this travels through the pandemic. And it traveled even further because healthcare and hospitals were the last ones to remove those barriers that had been put up during the pandemic. And so they were the last ones to take down masking, and they were the last ones to loosen their visiting rights, to open up doors that have been locked, physically locked on the campuses for guests to enter through. And so what we have seen now in the years after the pandemic is this continued ideology that healthcare is now associated with government. And I don't care what side of that argument, if you will, that you are on, healthcare now falls into that political hot potato of being bad or good, dependent on the issue at hand at that moment. And so on top of what we were already dealing with people who were injured in pain, fear, and anxiety, we now have political ideology. You saw that most recently with the tragic death of the CEO of UHC in New York City, where there are those in society who are hailing the assailant as some sort of Robin Hood. Over the last few weeks, I have gotten multiple intelligence reports around targeting healthcare facilities, not by foreign actors, but by homegrown U.S. citizens who believe that there is an ideology that needs to be pressed forward through violence against healthcare facilities and healthcare executives. And it's really changing the landscape.
Jason, we've certainly seen in the news over the last few months, over the last year, violence coming to hospitals and healthcare. We've seen it on the streets of New York City. We've seen it in a hospital facility in Pennsylvania, and we've seen it all across this country. Can you tell us the different types of violence that are being brought against healthcare and healthcare professionals and open the window a little bit so we can understand it better?
Yeah, I get to work with a great guy, Drew Necker from Co-Secure, and we really dove into this subject around violence in healthcare. And what we found is there's basically three types of violence. There's effective violence, there's predatory violence, and there's defensive violence, right? So effective violence, I think, was really what we were used to seeing. And again, that goes back to individuals who are in pain, fear, and anxiety, individuals who are lashing out from an emotional response, not an intellectual response, in the moment violence. What we weren't used to seeing and what you're starting to see is predatory violence, which really comes in two forms. An opportunistic predatory violence. So, someone who may be hanging out on the campus of healthcare to break into vehicles, or God forbid, to sexual violence on someone leaving, or rob someone leaving, because hospitals tend to be one of those places in a community that are open 24/7, where people are coming and going all through the day and night. What we're also seeing now that we're not used to, although it has happened throughout history, is targeted violence. The incident occurred in New York City with the CEO of UHC. The incident that recently occurred in York, Pennsylvania. The incident about a year and a half ago that happened in Texas, where individuals are targeting a singular individual that happens to be associated with or working at a healthcare facility. And when we dove into that targeted violence and really took a deep dive into that, what we found is targeted violence is the violence that is causing the most drastic outcomes. It is the violence that is killing individuals in the healthcare field, anywhere from, again, that healthcare insurance, healthcare system level, all the way down to the coworkers working in clinics and hospitals and pharmacies throughout this country. Targeted violence is where we need to direct a lot of our energy to make sure that we are preventing the worst type of violence that we see on our properties. The last one, defensive violence, really occurs when we're trying to mitigate or de-escalate a situation. And so defensive violence we understand through the actions that we in public safety may take to stop a violent individual on our property. And so effective violence has been there, but it's really ramping up in the total number of incidents that are occurring. And these are hands, feet, people biting, spitting. And I'll say this, domestic violence, interpersonal violence, is one of the biggest things that shapes violence and predatory violence in healthcare facilities today and on healthcare campuses. The recent issue in York, Pennsylvania was targeted violence. The individual came to the hospital with the intent of doing violence on individuals who had cared for his wife. And so this targeted violence is really giving us the worst outcomes. I don't want to minimize effective violence. Effective violence has an effect on those working in healthcare. We're seeing it in people leaving the profession. We're seeing it in numbers of individuals entering the profession going down. I've said this before, we're 600,000 nurses short in the United States at the current time, and that number is only growing. And so we need to make sure that people understand that any sort of violence perpetrated in, on, or around a healthcare facility is not socially accepted. It's not where we want to be. It's not where we want to go.
Jason, we've talked about different types of violence and how it's bearing itself out in the healthcare system, whether that's in a clinic or a hospital or on the streets. What are the strategies and approaches that healthcare systems broadly and hospitals and clinics specifically are taking to address the violence that's coming to their doors?
So that's a great question, right? What can we do in this tide or wave of violence in healthcare to help protect clinics and hospitals and coworkers and those that work in and around the healthcare system? It's a mind shift. And let me tell you that without AI, a lot of this wouldn't be possible today, that we would still be operating in the ways that we have in the past. In the past, the video management system of every large-scale healthcare system was really used to memorialize events. Something bad would happen, a camera would capture it, and afterwards we could go back and review the video images of what occurred to hopefully get some insight into the future of how to maybe not allow that to happen again, right? But that's really all we used video management for. Access control was just that, right? It was just for letting people in and out of a certain area, our department, or location. And we didn't have the AI, the capability to use it in a preventative fashion and form. It was all reviewed. We had to have human intervention, right? If we wanted to let somebody through a door that didn't have the proper code or access level, a human had to override it, right? Had to let that person through that door. If I wanted to monitor or live monitor a video management system, that meant a human being sitting in front of a bank of video wall, looking at 20, 30, 40. I think at one of my own operations centers, we had upwards of 400 camera views up on a wall. We know now that a single human being can watch approximately 16 cameras for 20 minutes with any proficiency. And after that, you've got to switch out and do something different. And so prior to AI, we were really limited in the use of the technology that we had. Now comes AI, right? And so we're in the burgeoning beginning, the fast pace of AI being used in all facets of our life, and that includes security, right? And so now I can do things in my video management system, my access control system. I can do things in my panic alarm system. I can do things that I've never had the ability to do before. There are AI sound intelligence algorithms out there that are listening, not recording, but listening for agitation in voice, listening for single words like help, that can direct resources in a timely fashion in the direction of those alerts with no human intervention, right? So instead of waiting to review the data on how somebody fell to the floor, if somebody says, help, I need help, now the AI is informing the human who may not have heard it or couldn't have heard it in the direction of somebody saying the word help. Someone who is becoming verbally agitated, they are bringing up the sound level of their voice, can now be detected by new AI, and we can start to de-escalate that individual while they're agitated and their voice is going up rather than their fists are going up, rather than they're acting out in a physically violent manner. There's AI out there now that is looking at massive bone structure through video management systems and trying to interpret whether someone is in a quote-unquote fighting stance. That they brought their arms up in a certain manner that we know to be that of a boxer stance or someone who's getting ready to punch somebody else. And so this AI is really helping us to step away from, hey, we're just going to use that to memorialize incidents, to how can we now use the systems we have in place to really start to prevent and to identify potential risks in our midst. And I think that's the most exciting thing. And then robotics and AI. You're seeing that in healthcare with different AI robotic nurse helpers who can bring supplies and supplements to the floor, all the way to roving robotic golf carts, basically, on your parking lots and your parking garages with multiple lenses and multiple sensors. Patrolling your lots at a time, as I explained, when we are really shorthanded in the role of public safety and security officers. So augmenting and supplementing our abilities as public safety agents and security officers throughout the healthcare system. And so AI is really helping us change the game, whether it comes from weapons screening at the portal of entry, to sound detection, to multiple forms of video, including facial identification, to help us not only identify threats, but help us with the throughput of patients in healthcare facilities.
Jason, one thing I've seen over the past 10 years, and we've seen more recently, is weapons getting into hospitals and doing harm. And it's doing harm more and more. What are some of the approaches hospitals have to prevent weapons from finding their way into hospitals?
Yeah, so weapons in a healing environment, they just don't go together, right? As the executive director of Mercy's Healthcare's public safety program, I was a part of designing the signage that went around healthcare campuses, alerting people that it was improper, not legal, to bring weapons onto a healthcare campus. But beyond that, then when we started seeing these violent encounters, suicide pacts, so individuals not only harming other individuals on our campuses, but harming themselves on our campuses. Again, a healthcare facility, a healthcare campus is a place of healing. We shouldn't be doing any harm, and we shouldn't be allowing anyone to do harm to themselves. And so healthcare professionals in the public safety field had to start identifying ways of preventing these items from being on their campus for two reasons. And again, I go back to effective violence and targeted violence. An individual in pain, anxiety, and fear who has easy access to a weapon may act from an emotional state and use a weapon in close proximity, even though they may have never thought of using it. The second is the individual with evil intent coming on campus with a targeted approach to violence needs to be identified, weeded out, and stopped before they're able to get to that target and perpetrate that violence. And so I think the battle cry you're seeing across the U.S. in healthcare at the current time, or at least I am, is weapons screening at the portal of entry, utilizing both public safety officers, ambassadors, and guest relations to de-escalate individuals entering their property, and really enforce the signage that we put up 2 decades ago, to not only inform individuals that healthcare is not a place for weapons, but make sure that they're adhering to that guidance and not bringing weapons into a place of healing.
In the lightning round, Jason, what are the 3 areas of risk or concern that a hospital security director should be looking at Monday morning?
The 3 things that a hospital security director, manager needs to look at: number 1 is their workplace violence committee. Does it have one point of contact, one person in charge? You want to make sure that you have an effective person who's in charge of that committee who can make change in the moment. The committees are notoriously a place where you send things to die and to be talked to death. And if you want to affect real change in workplace violence in healthcare, you need to have one person in charge who can make change in the moment. Number 2, we now know from the studies that the areas of greatest concern for the greatest violence causing death and serious bodily injury are actually outside of the facility, on the parking lot, in the parking garage, and in the green spaces. What are you doing to identify potential threats of violence in those areas? And number 3, what are you doing about targeted violence? Targeted violence in interpersonal relationships, domestic violence, which is really number 1 in healthcare. And number 2, what we're now seeing, and that's political ideology targeted violence, against healthcare workers because of what they do for a living, not who they are. And so you really need to identify those three areas. You need to define those, and you need to put in place programs, policy, procedures, and solutions utilizing the best capabilities on the market today to help you prevent those incidents from occurring.
Lightning round, next question. What are the two sources of information or resources you would recommend a hospital security professional to go to get more information, either about threats or mitigants or approaches to deal with them?
So I'm going to have to say the number one is that your public safety leadership team needs to be a part of either the IAHSS or ASIS, two organizations here in the United States that have strong ties and deep roots in doing their homework, in really digging into problems in security around all facets of healthcare and other industries, and can help identify solutions in the now. And number two is changing the culture inside your facility. And that's a top-down procedure. So the executive level staff at any healthcare facility needs to be invested in the safety and security of everybody that works on that campus. And so they need to make it a priority that they understand what's going on, and they're reporting back to their coworkers what they're doing and how it's working, whether it's having a positive effect or whether they've just had a negative experience, not glossing it over, but reporting out really what's going on and what they're trying to do to fix it.
Final lightning round question. What's the one piece of personal advice you have for a security director or a security manager or a frontline operator to help them advance their career? What should they learn more about? What resource should they do individually? What's that one piece of one-on-one advice you would give somebody to help them as they want to be continue to be a better and better security professional in the healthcare industry?
So, as a security professional in the 21st century, if you want to advance your career, if you want to move forward and really expand your knowledge base, you've got to get out of your comfort level with IT. IT security is where it's at. Again, it is AI, and IT security is a force multiplier in a time, again, when we're shorthanded on the human side. As a security professional, you should really dive deep into IT security solutions and AI. If you want to broaden your career, broaden your horizons, you need to make sure that you're working with the best in the business. A lot of times we find public safety directors, executive directors, vice presidents, managers have either grown up in the program that they're working at, or they came in from law enforcement, whether that be local, state, or federal law enforcement. I will tell you, as a veteran of law enforcement, 90 to 95% of law enforcement has never worked with technology other than what was in their own patrol car. As a veteran of law enforcement, moving into the private sector, understanding video management systems, access control systems, infant protection programs, AI, weapons screening devices, you need to make sure that you're not just working with who we've always worked with. The local safety and security dealer, but that you're really reaching out and going to and seeking advice from and partnering with the best people in the field with the best knowledge that you can learn from.
Jason, this has been a very interesting and wide-ranging conversation. Thank you for taking the time today with us. And more importantly, thank you for the work you're doing to try to keep us safe as we were out there in our healthcare facilities and trying to get the care for ourselves and our families.
I appreciate it. I really enjoy learning. And, learning is no good if you don't pass that knowledge on. And so I really enjoy being out, meeting people, learning from them, and helping them learn, hopefully, from me, my experience, and from everyone here at Evolve Technology.
Thank you for listening to Beyond the Threshold. If you enjoyed this conversation, be sure to subscribe and share the podcast with others who care about creating safer communities. Stay tuned for more expert insights and thought-provoking discussions in our next episode. Until then, thanks for going beyond the threshold with us. Stay safe.